Hi, everybody. Welcome to the Quench Life podcast. I am Jillian, and today I'm super excited to have with me Lisa, who's a cardiac nurse practitioner as well as an ICU nurse practitioner. That's a mouthful for me. I'm not good at words. She's also a member of Quench, so I'm super thankful to have her on the podcast today. Thank you for taking some time out to chat with us today.
Happy to be here.
So, my first question for you as a from a cardiac nurse perspective, what is the most significant misconception you think people have about strength training and heart health in particularly?
I think the biggest thing, especially for women, is, we're taught the American Heart Association says 150 minutes of, moderate intensity exercise a week or 75 minutes of vigorous intensity exercise. And they don't really speak to how important strength training is. So I think for myself, talking to patients about blood pressure control and weight control and how important it is to get in, cardio has always been what I teach the patients. But as time has gone on and we've learned more about, especially women postmenopausal, how important the strength aspect of it is to add. And the American Heart Association said, 2 to 3 days a week of strength training in addition to cardiac exercise like cycling or biking or swimming. And that was
Right.
just a recent thing that has come out over the last couple of years.
Okay. I was just going to ask, when did that change? Because I I hadn't seen that. So that's good that that's changed. So from your perspective, how does weightlifting physically affect the cardiac muscle itself compared to, say, general cardio that women tend to want to do?
Well, I think the biggest thing for women is, strength training is going to help improve both lean muscle mass and bone strength. And, for women, specifically postmenopausal, those are the things that you want to ensure that you do in addition to your cardiac stuff to make sure more from a balance and overall health perspective. We don't see a ton of difference in blood pressure control with just strength training. We do if it's in conjunction with cardiac and a healthy diet and kind of controlling your weight.
Yeah. Yeah, that makes sense. So what started your journey here at Quench? What brought you and you've been a member for the last few months, if you don't mind me asking, what brought you through our front doors?
Well, like I said, I've always talked to my patients about, the importance of cardiac activity and, doing something every day. But as I read more about personally postmenopausal lean muscle mass loss and how important it was to add strength training, I kind of felt like a hypocrite when I was talking to my patients about the importance of adding strength training when I was only doing cardiac stuff, biking and walking for me.
And how did you find your experience when you came into the gym? Did you have
Um,
a background in strength training?
I've, intermittently done some over the years, but I didn't feel like I could just safely start um, strength training without having someone teach me the right way to do things. Because the last thing I want to do is, the last thing I wanted to do was to hurt myself.
Sure.
And like I try to teach the patients that I see, the biggest thing as women over 50 we can do is strength train to prevent a fall. So for me, coming into the gym to have one-on-one training and support was the biggest thing for me, instruction wise.
Yeah. And you've been at the gym now for a few months now, and I feel like you've been making such great progress.
I try.
No, you've been doing fantastic. You've been getting so much stronger, and I think confident in yourself, being in the space and being in the strength training space, which I think is always so much fun to watch everybody grow and build in that space.
Yeah, and I think the biggest thing that I think I've said it to, most of the staff members there is that there's, there's every shape, every size, every ability. And I think that's what's nice is that, everybody feels welcome. I think everybody that I've talked to, whether they're, new or have been coming forever. And I think that's what's for me was refreshingly different in a
Well,
good
I'm
way.
glad. Well, I'm glad that we could check those boxes. So, as a nurse, why do you think that the strength training is so important? And how should we be balancing not only our cardio, but with the strength training? Like, what's your take on that and recommendations that you make with the patients that you work with?
So the biggest thing that I've learned over the last, I'd say, year, because I've done a lot more reading about strength training, is I was really surprised at how much muscle mass we lose. 3 to 8% every decade over 30, and then 5 to 10% every decade over 50 if we don't incorporate some kind of strength training. And then, as we get further out from menopause and our estrogen levels drop, that's where we see estrogen's impact on muscle strength and bone density. And, women that don't do some kind of strength training, the research has showed us that you're 2 times more likely to fall and 3 times more likely to break a hip. And mortality goes up, exponentially after a hip fracture, especially for a woman. So for me, those were the key determinants in
Factor.
in
Yeah.
in trying to make a change both for myself and when I talk to patients.
That's an interesting thing on the hip fractures. Why does that go up? I'm just being nosy. Why does that raise so much just specifically for women in the hip fracturing?
Because if you don't strength train and build more bone density as you get further out from menopause and estrogen dips more,
Mm.
then you're more likely to have a fall. And with falls come hip fractures for women.
Yeah. 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 I think that with our generation, my grandmother, she never lifted weights, and she was probably 100 pounds soaking wet. She
Yeah.
was all boobs. I loved her to death, but that generation wasn't growing up with taking care of themselves. So, my mom watched her mom do that. And I think that we're seeing kind of that generation trickle down of we're taking care of our parents. We want to be able to care for ourselves. And we're starting to see long term how, that strength training component becomes for us in our lives.
Yeah. Definitely.
Except
Definitely.
except especially the tripping and falling. I don't think that we realize how, big that one is and how high all of that increases as we're aging.
Oh yeah. And then there are other studies that show that even if you do 6 months of strength training, when they do bone density scans, just 6 months of progressively increasing your weight, what you lift, shows an impact in bone density scans in just 6 months.
Yeah. So it's never too late to start is what you're saying.
Correct. Correct.
Now, what if somebody's, concerned that they have high cholesterol or they've got some type of chronic inflammation or anything like that? Do you feel like that's still somebody that's struggling with that should be involved in a strength training environment?
Yeah, I mean, there's no, I mean, obviously, everybody's individual. And, if somebody is completely sedentary and they have other, health conditions like, diabetes and high blood pressure and stuff like that, they need to make sure that their heart is strong enough to exercise. We do a lot of testing in the office. We actually just do an exercise stress test. We put somebody on a treadmill for, 6 to 9 minutes, and you can look at their EKG to see, where their heart health is. But from a cholesterol standpoint, we know that there's 3 components to cholesterol. There's triglycerides, there's HDL, which is good cholesterol, and LDL, which is bad cholesterol. And we know that triglycerides and LDL are both directly impacted by exercise. And you can reduce both of those numbers
Yeah.
by adding
Just
exercise in conjunction with, a fairly healthy diet.
Yeah, I don't think everybody sometimes understands how simple just going for a walk, like how big of an impact that can have. It doesn't have to be this super overcomplicated thing. It simply can just be going out and going for a walk while getting some fresh air and, less stress.
Yeah, there was a recent study that actually the American Diabetic Association put out that said, if you even take a 10-minute walk after each meal, so 3 times a day, has a positive influence on a person's ability to keep their blood glucose levels stable. So without having peaks and valleys. So not necessarily having to do, huge chunks of exercise at a time, but short, brief periods have a positive impact both on blood sugar control and on cardiac health.
So what would your recommendation be for anybody that's, thinking about starting some type of fitness program? So it's important that they're checking in with their doctor to make sure that they're cleared. What steps would you suggest somebody takes that is interested in that?
I mean, we tell people in the office, all the time to start, start slow. We try to encourage, obviously 30 minutes of exercise, but you can break it up into 3 10-minute sections. We tell people if you can't get a 30-minute walk in, try to do 3 10-minute walks. And then the biggest thing that we talk to especially older people over 65 about is just being able to support their own body weight. So simple things like a modified push up against the counter, just pushing their own body weight, is a simple thing that we, encourage people to start with. But there's really no one that can't do some form of exercise um, at whatever stage of life they're at.
Sure. Jumping in, at any time, I feel like people think that, it's too far gone or it's too late. But, you can start at any time and still find success and fitness and allow your body to build bone density and get stronger.
Yeah, there's a book that was recently published. Dr. Vonda Wright, she's an orthopedic surgeon. She also did a lot of research into like functional strength training, and she did a lot of research on um, starting exercise in your 70s, your 80s, and your 90s, and even the impact of strength training at all those different decades of life.
Yeah, that's
Unbreakable is the name of her book.
yeah, I think I did read that. That was a good one.
Yeah, she's orthopedic surgeon, and then she did a functional medicine specialty training. So, but she did a lot of studies on specifically strength training and how it impacts women's lean muscle mass and bone density.
Yeah. I think there's so much research too that's just starting to come pop up with women's health and this type of information just for so long. It's been not research, especially when we're talking about menopause, pre and post, and all that good stuff.
Yeah, there's
Yeah,
a
there's
lot of the studies are mostly men. So the
exactly.
research is starting to catch up with, modern America.
Yeah. Yeah. No, I agree, which is good. We can all use it.
Definitely.
So for your suggestion for somebody that was like you a few months ago, before you came into the gym, somebody that might be hesitating, wanting to come into the gym, do you have any words of wisdom for them on, feeling comfortable to walk in the door and look for some help?
I think the biggest thing, and we all joke about it, is that the hardest thing about the gym is walking through the door. And that's really the biggest thing. But I know like for me, just the 6 week mini membership was, a huge enticement because it's like there's no obligation. Like I can try it for 6 weeks, and if I'm not happy, but I think I told you on my second or third session that I was ready to sign up because just I like, I think that it's you guys meet us, you meet every person where they are. And I think that's the biggest thing. If you have somebody that, I had a lot of cardio experience and I had some strength that way, but I didn't have a lot of, upper body strength or experience with exercise. And I think that,
Mm.
having one-on-one sessions and then small group sessions, plus, the option of doing things like, spin or boxing or, some of the other rower, people can, I think other women can get the most out of it in, their own way.
Yeah. I think as girls, when we try to find something, it's like we jump in, at level 10, when really we should be starting at level 2 or 3.
Yeah.
So, it's really important to me that everybody takes their time when they're coming into the gym because you don't want to feel like you got hit by a bus. I think so many of us have just had so many negative fitness experiences where you do something that's too much, too quickly, too soon, and you're like, see, I am out of shape and I can't do it. So we just like to go at it the other way so that you feel safe and comfortable and confident when you're in the gym.
Right. And I think, there's enough support around that, you are corrected if your form is wrong and you can ask for clarification. And I think for me, that was the biggest thing is that, it's not intimidating and the atmosphere is, supportive and encouraging.
Yes. Well, we love having you here. Sorry. All right. So do you have any final thoughts that could be as a nurse to encourage listeners to go and pick up some weights today or to get moving into some type of fitness program today?
I think that, the biggest thing is, take the first step, come in and try. And I think that most women will be surprised at their level of strength in what you can do and what you need some help with. But I think that I know, like for me, I had some things I was stronger with that I was surprised with. And then,
Mm,
I've made steady gains as the last 4 or 5 months have gone on. And
yeah.
I think the one thing that you said to me when I first started was you make an appointment and you keep it. We're more apt to keep it if we schedule it and put it in our schedule. And I actually, like, I walked out the door and I was like, yeah, that's a bunch of BS. I don't believe that. And it's so funny because it is so true. As women, it's like if we write it in our calendar and it's an appointment, we're not going to blow it off.
Yeah.
Um, and I think that's the biggest thing is that, like, if I don't show up, I'm taking up the spot that somebody else could have taken.
Yeah. Yeah. Well, that's sometimes it's just the simple things, right?
Yeah.
Well, I appreciate you jumping onto the podcast today, Lisa, and we will see you at the gym.
All right. Thanks. Have a great day.